With a 92% unemployment rate among people with intellectual disabilities in California, a lot of businesses have not worked alongside people with developmental disabilities.
It's crucial that if people that we support are going to be valued members of society, that they be valued members at the workplace.
Everyone has something to offer. Everyone wants what you and me have, which is a reason to get out of bed in the morning, a way to support our family, and something that we can talk about with pride in the world.
A number of years ago, we were feeling stuck in that we were really only developing jobs in a couple of sectors, retail and grocery. And while lots of people we support prefer to be in those sectors and enjoy those jobs, it didn't feel right that those were the only sectors that people were finding employment.
Employers have been hesitant to bring any new employees on, and yet we took that opportunity to really push the bar and network with new employers. And now we find that the individuals that are exiting from one of our training programs, Project Search, have a rate of about 17% placement in retail or grocery. The remaining individuals are placed in office, support positions, or other higher paying positions with great benefits.
So we really pinpointed healthcare, and a big part of that was discovering this model out of Cincinnati Children's Hospital called Project Search, which is an intensive training model where people are doing internships within a host business. That enabled us to learn about the healthcare field and where the nexus is between the jobs that were going to be in demand in the future in healthcare and where that met the skills of the people that we work with. So we really made a concerted effort to figure out where the stable and higher paying jobs would be, and also to figure out where those jobs existed in sectors that were growing, and that we could do some training and be a bridge so that people had skills that were going to be valuable to those employers in healthcare. It's difficult because the funding structure doesn't clearly reimburse you for job development activities. It's the money that is labeled for job development through the Department of Rehab it's not enough money to cover what we do. So we're always actively looking for other streams of money, things like Ticket to Work. We write a lot of grants, and employment is a fairly interesting topic to foundations, so that's another way. So what you're looking at is not necessarily always raising money for job development or looking for funding that specifically supports job development, because we're really a social justice organization to help move people forward and to help people get jobs. It takes a village, so the leadership of the program needs to be involved. We have a team of 3 of us that do job development. It's a piece of our jobs, and we sort of team up on trying to cultivate employer relationships. So, we're presenting sort of this approach that's very collaborative and comes across to employers as very collaborative.
It's really helpful to be able to find a way to be introduced to hiring managers or department managers, and even better, the decision makers, the people who want to direct and drive HR to feel empowered to do something a little out of the box. The global way to really look at what the business community can offer is to search through the data. Who are the biggest healthcare providers and healthcare entities? It's really important to know where their future initiatives are going to lead them, and what their current struggles are, and how they proposed to solve the problem. So we can become part of that conversation if we know more about where their business is going to, rather than come to people and ask for their time and a handout. We are giving them a resource to meet their needs and whatever their future goals are.
So we've found that building a program that uses internships and customized training, services provided by a job coach, embedded within a host employer that's large enough, is a really effective way to identify the type of work that's needed at that employment site, and gives people that we serve real training opportunities to learn the skills that are going to be valuable to that employer. We have examples at Children's Hospital, at the County of Alameda administrative offices, and now at Lawrence Berkeley Lab, where we've built these training pipelines. We call them pipelines because it's really a different approach. We are building a way that, and having a concept that we're developing a pool, a workforce that employer or other similar employers can draw from, and that we can promote as a pool of people who are qualified and ready to go to be successful employees.
And one way we could do that is through what we call a working interview. So we often ask an employer if they would provide an opportunity for someone to come in with support of a job coach to actually perform some of the work that they're looking to have completed for them. About 90% of the time, an employer says yes to a working interview, or what is also known as an external situational assessment. They wind up hiring the individual.
So this requires very close, careful consideration of the job itself, which means going on site, asking questions about to the hiring manager about what are the skills that you require, what is the equipment that needs to be operated, and asking to observe somebody who's currently working in that position so that you'll get a better idea. If there isn't a person that's a good match, then no referral should be made.
So we had a real problem, we had a real task that needed to be executed, and we saw the clients in the developmentally disabled community not as problems or challenges, but as a resource to help us meet a problem. And that frame is actually essential, lest you suffer from the disease of the helping professions, which is imprisoning people in the challenges they face. It's absolutely essential that those of us who are engineering social justice and engineering new opportunities for marginalized communities do so with careful attunement to the business models and leveraging opportunities that make our work scalable.
We were growing a lot a year and a half, 2 years ago. We started to realize, oh my gosh, there's a set of things we need to get done that nobody wants to do. But it's pretty important to have an efficient way to have our material that we order received and get to the desks of the engineers who needed to run the experiments.
Folks in materials management, in HR, in child life services, in psychiatry, in the dental clinic.
So everything from filing and pulling documents to reconciling encounters, making phone calls.
Working in medical records, scanning documents.
But we also really believe in the wisdom and intelligence of the people we serve. So we took that experience of training for the health careers and brought it to bear on the challenge of how to build meaningful work experiences for the developmentally disabled. And for us, that meant beginning with real work, not make work, but work that actually contributed to the health and well-being of other people.
When we looked at the skills that we needed for some of the duties to help us be effective and efficient, it was clear that somebody like John is the best person for that job. He happened to be disabled.